All right, so we are ready to start our second half of morning presentations. And the first presenter will be Dr. Stoffel. Michelle is an anatomic and clinical pathologist specializing in clinical informatics and patient-centered technologies. She's an MD and PhD graduate from the University of Kansas and APCP, anatomic and clinical pathology residency graduate from the University of Wisconsin, followed by fellowship in clinical informatics at the University of Washington. Michelle's research interests are in clinical informatics and patient-centered technologies. So please welcome Dr. Stoffel. Thank you.
All right. Thank you for that introduction. Let me know in the back if you can't hear me and make sure my little pointer works. Okay, yeah, so I'm really excited to be here today to talk with you about how informatics education can empower pathologist careers. So by the end of this session, I hope you can describe the role of informatics in the evolving pathology practice that we've already gotten a preface of, and then discuss the needed adaptation of training and ongoing continuous learning to meet those expanded needs. And then we're going to talk through some specific actions that you can use to prepare for current and future practice. So, a little bit of housekeeping first, because there ends up being there's a lot of sometimes confusion around different terms, bioinformatics, clinical and medical informatics, pathology informatics. I just want to highlight that, clinical informatics, which is, I think, sometimes also referred to as medical informatics, is this incredibly broad field that really encompasses the application in any way of informatics applied to healthcare services. So this, ranges from, just the content and format of all communications up to highly sophisticated AI applications, and it encompasses really, all aspects of healthcare. That's really not what I'm talking about today. But lab medicine and pathology informatics, which all of you are, familiar with as a discipline, is a subspecialty of informatics, one of the oldest subspecialties. You could say the founding subspecialty, and pertains, specifically to all of the technology and information related, aspects of the lab. The lab, and when I say lab, I'm just going to say up front in this talk, I'm one of those people who see very little distinction between clinical and anatomic pathology. I try wherever possible to say lab medicine and pathology informatics. You could say like LMP informatics, because I really do think that they are becoming increasingly integrated. And so, in both AP and CP, we have a lot of physical instrumentation and benchside workflows where those workflows need to be interfaced into the electronic medical record and downstream data. And everyone here is probably familiar with that. But hearkening back to that first slide, I really do want to call out that what I think often gets underappreciated is that pathology in LMP informatics also includes really lab and pathology specific applications of clinical informatics, such as clinical decision support, clinical user interface design. This goes back to, we really are working with the clinician and the patient. I actually had a whole section about that in this talk that I had to take out because of time, but I just want to call out that it's an important part. So let's talk about informatics' role in your practice goals. So I'm going to preface this with saying that I do not think that the expectation, obviously, is that most or even many in this room will end up pursuing, formal informatics fellowship or certification. I don't think that's realistic. I think it's actually going to be coming more where informatics needs to be built in at a baseline level in every pathology specialty. with that said, I just kind of wanted to give an overview for those of us who do get formal training in informatics. This is pathologyoutlines.com has a great job board, and they also publish their annual summary data. And so I just wanted to kind of highlight here for job postings where informatics is a required subspecialty training. It's been pretty steady for around the past year, 5 years at 2.5% to 3% of job postings listing that. So it's kind of on similar ground with other less common dedicated subspecialties. So with that said, why should everyone in this room invest in learning and even getting, potentially formal training of some kind or certification in informatics for your career empowerment? If we talk about the word empowerment, it does sound like something that would be in the title of a self-help book, which is because I think it should be, right? I think this, this idea of gaining knowledge, skills, and the tools to be able to have the most control that you can over the trajectory of your career and therefore your life is really important. And we see a lot of anxiety around technology change, and I think that is warranted because people feel like they may not have control over it. So we want you to be able to get the most out of whatever your career is, or your current career or planned. We'll talk about ways that pathologists can future-proof their careers, and then highlight some examples of how informatics education can open doors to new opportunities. And I think Dr. Wendy, the last speaker, was a great example of that, where familiarity and comfort with technology, can lead to, very fulfilling portions of your job, or even separate jobs. So I think, when talking about how informatics education can potentially benefit, I think it's important to address burnout. Burnout, which is, I think it's now officially in the DSM-4, or sorry, whatever version we're on now. Like, I forget actually what version we're on now, is characterized by these three, classic features now of related to professional activity, overwhelming exhaustion, a sense of cynicism, a feeling detached and impersonalized, and then also even very accomplished professionals will feel this sense of ineffectiveness or lack of control and accomplishment. This has been, I would say, unfortunately, like steady state phenomenon, I would say, in US healthcare now for at least a decade. There's been a couple of large studies on the impact and pathologists in particular. The most recent one is this from 2022. So really, this was still pretty soon after, or really still in the pandemic. And so this was a large survey done through the AB Path continuing education. They really highlighted on, and sorry, this was a survey where they asked pathologists to recall during their different years of training, and then afterward, if they were practicing their levels of burnout. So they really focused on, during the PGY years and those early years after. And overall, they said compared to other specialties, pathology is still doing relatively well, but especially during those early practice years, there's still, I think, a pretty high level of burnout with almost half responding. And so here's the visual for that, and showing here that really, I think what's really notable is that I think still almost half to half of people in residency or early training reporting feeling those persistent negative experiences is not good. And then also, there is a lot of time, hopefully, beyond those first 3 years in practice. So this doesn't really tell us more about the continuum of your pathology practice and those opportunities for new challenges to present burnout. I think also we have to address, while I'm going to be talking about informatics as a solution, it's also established that informatics is a big part of the problem when it comes to burnout. Likewise, this group of researchers are essentially the national experts on conducting studies on the impact of burnout in its relationship to EHRs. And so this most recent study was a national survey of all specialties, with about 3% being pathologists, which is, more or less on par with the population of pathologists within physicians as a whole. I'll skip to the next slide, but the EHR, in comparison to other technologies, still does not perform well, which we knew. But what's interesting was that they actually correlated the perceived usability of the EHR, with the odds of actually developing burnout, and found that the respondents who find the EHR more usable were less dissatisfied with it, were also less likely to suffer from burnout. So just highlighting here on this side here, this is what's called this a system usability scale. It's a standardized, usability 10-question questionnaire that's been used since late 80s for a variety of technologies. The score that's calculated is used during a somewhat complex formula, but just want to highlight here, that here's your technologies like the microwave and Google search, and then here's the EHR, which gets an F. And you can say, well, is it really fair? We're not trying to practice medicine with a microwave, but when it comes from, to the I guess the perspective of, perceived usability and the experience where, EHR users feel that the EHR gets in their way, it doesn't really matter, right? If it's a fair comparison, we know that this is contributing to, to dissatisfaction. Focusing more on pathology in particular, I think it's important to highlight a phenomenon that's happening across all technologies, and this is what's called the digital divide. And just discussing digital pathology as a use case, I think we're increasingly in a realm of widening inequality. And so digital divide refers to this unequal distribution, either in the access and or the adoption of technology. So what we're seeing, especially in the realm of digital pathology, is this landscape of haves and have-nots. And this has to do with access to the instruments and the materials, other IT resources. Even in some scenarios where the resources are available, there may be adoption gaps for various reasons. And then importantly, this, I think, translates to educational gaps or gaps in educational opportunity. And so this is, I think, a real problem. Getting over these gaps and barriers to change can be difficult. It is not, or say rarely spontaneous. Just to highlight this, I wanted to show this study that came out actually in 2021. So this is really, still squarely in the pandemic, but it was focusing on the rapid adoption of change by academic faculty, residents, and faculty in pathology right after the beginning of the pandemic. And as all of us, recall, there was a rapid scale up of virtual conferencing, virtual slides, et cetera. And so overall on the graphs here, this is for the faculty, and you can see for the various technologies, including digital pathology all the way down to conferences. Before the pandemic, almost none used them. And then after the pandemic, there was increased adoption in all of them, really, with notably the virtual conferencing being the biggest area of uptake. And then compared to trainees, who actually had a very similar usage before the pandemic, and then afterward, quite a bit more usage of all technologies than the faculty, kind of similar use of virtual conferences. I'm assuming the faculty and the trainees are all on the same conferences here. And this just really highlights, that overcoming these barriers to implementing and adopting technology really takes an intentional effort, I think, at the institutional level. So let's talk about what are the informatics knowledge and skills that pathologists whether trainees or practitioners, need for empowerment. For the sake of time, I'm going to only discuss these items in red, since these are the areas of the most rapid change and the highest impact. Not to discount that all of these standard basics of LIS, interoperability are also increasingly important. But I think the areas of really rapid change for all pathologists are in digital pathology, the use of AI, which often overlaps with digital pathology, and I'm also going to highlight teaching informatics. And really, digital pathology and AI, for all practical purposes, this is really something that's come up within the last decade in a meaningful way. So, I don't think many would argue that digital pathology has a lot of potential to facilitate the work of pathologists. Examples include remote and virtual ability to work, potentially a streamlined workflow. If you think about, especially for anatomic pathology, a lot of the friction in the workday has to do with these physical logistics, right? Of glass slides moving around, doing phone tag with people, et cetera. The ability to integrate data from microscopy and the EHR, and then obviously facilitated collaboration, and importantly, for later use, generation and contribution to this growing body of data insights. So I want to highlight a very recent study that just came out of Finland, where, admittedly, likely a different, practice and infrastructure environment there. But this was a study that highlighted the experience of two labs that transitioned to digital pathology, and then they surveyed those pathologists on their perceptions a year after digitization. So, notably, this was a pretty rapid adoption process they had, with 3/4 adopting digital pathology within a month. And then overall, in the survey, the majority considered digital diagnostics faster within the whole context of the case logistics, with a minority, 17% preferring light microscopy. And then when it came to just is the screen faster to use than the physical microscope, squarely half of them preferred that, and really only 1/4 still preferred using traditional microscopy. So just as an example of, just in terms of the logistics alone, when you're using digital pathology as a microscope, really, right? Which we know this is really only the tip of the iceberg in terms of how digital pathology will be used. So in terms of, what do all pathologists need to know about digital pathology? I've kind of broken it up to, different levels of knowledge acquisition and engagement. So I want to highlight level 1, what I think, and what I'm referring to based on the national curriculum here, are basics for pathologists using digital pathology. I'm going to skip ahead to a quick, very shameless plug for the Peer Essentials Resource Toolkit. So Peer is Pathology Informatics Essential for Residents. It is a collaborative effort among multiple professional organizations. It's been around for, I think, more than a decade, since before I was in training. I just want to highlight that they earlier this year just released version 5, and I will say I'm thrilled with this version. Yeah, I think it is a big improvement in usability from other versions. Previously, this was a 4-part document-based resource that had just a lot of resources. It was a little bit overwhelming, even though it was very good content. They have really streamlined this and boiled it down to a single, very approachable document with, I think, straightforward, easy to interpret objectives for learning. This is actually the one for AI I'll talk about later. But then also a list of recommended resources. This is page 1. There are 2 pages. I also just want to call out that usually the top recommended resource for every topic is Dr. Harrison's freely available teaching slide set that we'll get to hear from Dr. Harrison later. But going back to this is what Peer has recommended as kind of the base for pathologists using digital pathology as a diagnostic tool. And so, as expected, right? This would be including the basics of image capture, understanding the basics of, image calibration, file types, the file handling and manipulation, the roles of image analysis in applications that do similar functions that pathologists do today, like cell counting, mitosis, quantification, et cetera. And then a baseline understanding of the validation and regulatory aspects, since CAP does have a checklist, and this is obviously an area of expanding domain. So I think that's what every pathologist who uses digital pathology will need to know. I think there will also be an increasing need for pathologists who participate in what I'm calling level 2. So apart from utilizing digital pathology, kind of similar that you'd be using a microscope today, in contrast to how I don't think pathologists end up needing to be really deeply involved in the management and and development of microscopes, although some are. I do think more pathologists will need to be instrumental and contribute their skills and knowledge that are needed for digital pathology implementation and oversight. And so this likewise recent paper, you'll notice most of the papers I'm talking about have come out within like the last 6 months, right? This is a really rapidly emerging field. This paper is great, and it highlights the gaps and the need for for standardization when it comes to competency in practice and leadership around digital pathology. So these are the areas where these authors predict there will be a need for additional involvement by pathologists, and it has to do with really deep understanding of the technical and regulatory validation needs, developing. Oh, and I also want to say, like, a lot of these actions are also, I would say, at the pathology community level, as well as the institution level. So development of high quality whole slide imaging data sets, deep knowledge of LIS EHR integration with digital pathology, which I think is still in its infancy, and then directorship and governance efforts in terms of troubleshooting, working through safety issues, and then continuous quality improvement. So this table from that figure highlights, I think, what are a lot of the challenges in current state in acquiring digital pathology knowledge and skills. So if you want to go improve your knowledge on digital pathology today, there are many, many resources and ways to do that. But what I think this paper highlights is that these are still, I think, in an emerging state of standardization and consensus from the pathology community in what the gold standard should be. So they highlight the pros and cons, and I would say the pros for almost all of these resources for learning, journals, live meetings, books, web-based atlas, is that they're fairly accessible, low cost, if not free, and can be done asynchronously in many cases. The downside is really, well, they're not all free, but I think there's a lot of heterogeneity in the approach and the scope, and then really, where we are, I think, in technology in general and in digital pathology is a lack of bandwidth in mentorship. So one-on-one or high quality mentorship is still really important, and we just haven't really figured out how to scale that yet. So their recommendations include, which I think is very, very clever, is that we really should be piggybacking digital pathology now to medical practice developments happening in pathology. So when we are rolling out a new classification scheme or a new process, we should be using whole slide imaging for the training of that. Contributing as a community to expanding open whole slide imaging libraries. I honestly, from the last speaker, Dr. Rendy, who was talking about using AI generated examples of classic cases like Hodgkin's lymphoma, we should not need to do that, right? Every institution has hundreds of these that they come over across the decades, and we should be scanning those and contributing those. I mean, it's great that if we can, but it really is not something we should have to do. Including whole slide imaging content as the data as part of journal submissions. So, as part of supplementary data, like the raw data that you can submit today for other uses. And then ensuring AI transparency. I think adopting modern data-driven models is really important. So a lot of what's being done right now in digital pathology and in AI is taken from the approach of let's automate or facilitate doing the same task in the same way that pathologists do today. Let's just make it, digital. Whereas this is highlighting a focus on novel approaches that pathologists may not be doing today, may not even be possible with only a human in the loop. But those are where we're going to have big gains in terms of innovation. And then, really coming together as a scientific community to reinforce those publishing and reporting standards for AI in particular. So with that, I'm going to transition to, I highlighted some areas where I think digital pathology will be of increasing importance to pathologists, and then different levels of ways you can increase your learning and that you will be involved in the future if you aren't yet today. And so let's focus on AI. This figure highlights, I think, some of the myriad ways that AI is predicted to facilitate pathology practice and, ideally enable empowerment in terms of, better, easier routes to diagnosis, efficient workflow, more effective and efficient ways to support trainees and to teach in a versatile way. And then obviously this, ongoing, I would say now 30, 40-year plus battle to achieve more meaningful integration of AP and CP and clinical data. And so really, I think, the highlights of this is really in this green bar here, right? So we want to get to a place where AI is helping pathologists do their work better, do it easier, and to do it quicker, ideally, because we know we're going to have to scale up. I just want to say one thing. It's outside the scope of a separate discussion for this talk, but it's a discussion that's happening, I would say, all over IT industry as a whole. My husband is a computer programmer, where he's having this same talk with his bosses right now, as we are in medicine, where everyone's saying, okay, let's identify where AI can help, help offload some of the work, right? What can we replace with AI? And I think, his response, I think, is the appropriate response for medicine as well, is we need to think about what are the skills that are value added, and what are the skills where, even if they may seem redundant or rote today, we still need our juniors to do, because 5 years from now, we still need somebody who's an expert in that work, right? So we should not be using AI to replace those tasks which are integral to becoming a doctor or becoming a pathologist. Arguably, there are a lot of the tasks that we do in medicine which at some point have a limited return on value in terms of critical thinking and patient care. So those should really be the highlight. Well, I was hoping this would all fit on the top. This is one where I should have said LMP pathology or LMP informatics, but I want to say that lab medicine pathology, as together, I think, compared to other medical specialties, are really well poised to integrate AI. And that is because a lot of the processes that need to happen for implementing AI safely, we already have a model for that in lab medicine and pathology. We already have a robust regulatory framework. We already have a framework for validating our assays and our processes, and for challenging them with unknowns, and for monitoring for safety. And so I do think that the skills that you have today as a pathologist at a laboratory, and especially if you're already involved in directorship or leader, are going to be transferable to to the era of AI. But then if you don't already have that knowledge and skills, you're going to require gaining some. And then along with that, to make it easier for all of us as a whole, we need a more standardized approach to demonstrating competency in these areas. So going back to the peers' recommendations, here's the basics for pathologists using AI as a tool, for sign out and diagnosis, and I think all these also apply to as a tool for, just using, for example, large language models in your work in teaching and research, et cetera. So you should understand basic categories of algorithms, should understand the definitions and appropriate applications of tools like generative AI, both for language and for image analysis, understanding best practices of performance verifications and how those translate from the parameters we usually use in laboratory medicine and pathology compared to how the AI industry and researchers apply them. What are the limitations and common performance problems that may be encountered, and how will you recognize them, and what do you do about it? And then I'll talk a bit more about the framework for AI implementation. And really importantly, understanding the sources and implications for ethical bias, and then obviously very important to pathology, regulatory considerations as well. Taking it a little bit further, I wanted to highlight this also very recent paper that just came out of, came from the Netherlands. So this paper discusses the Dutch pathology residency framework, which is a little different than the US, but they discuss both. And they propose that there would actually be a formal residency milestone added to address using AI in diagnostic path practice, and including most of these same elements that Peer Basics covered. And I think really also addressing, I would say inevitability, but what would go into integrating AI into reports and what that means for pathology, patient consent, et cetera. I'll talk more about education. We're not there yet, right? So for level 2, so this is kind of where, and this applies to digital pathology as well. For anybody who's learning, teaching themselves, being taught technology principles and skills, digital pathology, AI, whatever, you start and you gain a baseline understanding and you go deeper, right? This goes for pathology knowledge as well. So I would say where, level 2, if you're a pathologist who is not just maybe using AI as part of your day-to-day tools, but then wants to be involved as part of your role at the next level, it's helpful to have a deeper, more advanced knowledge of those topics. But I think a critical element is then the development and application of leadership skills. So I just want to take a moment to stop here and say, I didn't know where to put this slide, but I think it's really important, is that, if you end up working in informatics in any way, you can't get away from leadership and vice versa, right? And so I think, because of the central role of informatics and data, if you are a system or pathology leader, you are being asked about IT-related decisions today. You end up, we end up getting a hold of you to ask for help and decisions about informatics. So, and this is not specific to AI, but, if you already have those skills, then adding that even baseline technology knowledge can really help, you go to the next level of being effective for your organization. Likewise, if you end up as an informatics expert, I would say at any level, you end up in a leadership role, whether formal or not, because we're looked to for help to make decisions. And often the easiest way to make sure that we're there at the decision-making table is to invite informaticists or informatics experts to be in a leadership role. So if you're looking to get into leadership, I would say informatics expertise is a pretty reliable way to get there. And then I would just wanted to add on that pathology informaticists are often doing an extra layer of translation between, system-wide leadership, clinicians, and then other areas and pathologists and other areas of IT. So here's an example of, pathologist role in AI governance. And so this is an example from a paper on a typical vendor AI solution selection framework for implementing an AI application. I won't go through all these, arms of it, but I would say especially pathologist expert may be involved in all of these, but really is critical, I would say, at that approach to evaluating what is the meaningful clinical, operational, and security risks and benefits. This is a language that pathologists should understand, and lab medicine experts. What is an SOP, a standard operating procedure? This is from a recent edition of ASCP's critical values, but we are seeing this need increasingly more and more, where we need to have a structured approach to have outlined SOPs about the appropriate use, change management, et cetera, applied to AI in a similar way as we would for an IHC stain or for a laboratory assay. And this is where, at multiple points here, a pathologist or a laboratorian will be needed. So I just highlighted a couple examples of AI governance and monitoring. So pathologists often end up involved in AI development and deployment. I didn't know what to call this level 2.5 or 3, because I don't think it's more important than governance and monitoring. A lot of times the people who are involved in one are involved in the other. It may be more involved in many cases than than oversight alone. I also wanted to use this opportunity to highlight this first in what I am anticipating will be a great series of papers coming from our colleagues at Mayo. And this is the first delivery in it, and it's establishing a comprehensive artificial intelligence lifecycle framework specifically for lab medicine and pathology. I'm not going to talk a lot about this for the sake of time, but I really just wanted to highlight the reason why I have this highlighted here is that this framework uses what's called technology readiness levels. This is a construct, I think, that originated in the US military, but it's really this framework for assessing where is your organization ready, what level are they ready to adopt, a potentially high risk technology like AI. I think what's great that they call out for this, this is that here, okay, sorry. And this is sort of like a version of, life, where you start out at the base level of unreadiness, and then you progress through and you acquire, more knowledge, skills, and, technology application children. And then you end up at the end where you're, deployed and managed as an AI mature organization with a full suite. What I want to call it here is that this model highlights that there can often be what are called switchbacks. It's not a, proceeding through this from beginning to end and with no interruptions. Sometimes you do need to kind of circle back and go back to develop, workarounds, adaptations to challenges. And that's from my work in IT. That's where we really rely on our domain experts in the lab, in pathology, the ones who know the workflow. Because if IT or your enterprise is doing this in a vacuum, you're going to have a good chance of ending up with implementation that's off base. Also, not going to highlight, this is a little bit overwhelming, but the reason why I'm putting this graph there, this is one of several in this paper that are like this. I think this accurately conveys how complex and involved the process of implementing an AI tool for deployment will be. This is the version of the graph that shows what would happen if you were deploying a vendor created solution that you're validating and implementing in your organization. So what's in gray is what would be the responsibility of the vendor, but what's still colorized is what your organization would be responsible for, proceeding through these technology readiness levels and going through the different areas of IT and other stakeholder involvement. I just want to call out that I think it is really important for domain experts, people who understand the pathology and lab medicine workflows, to be having the discussion up here at the beginning in terms of, is this thing a good idea to implement at all in our workflow? They don't necessarily need to be at all the meetings that happen here and here and here, but then they also should be definitely involved in this, getting towards green. We're going to go live with this thing. What is this workflow going to mean for our lab staff? What is this going to look like when the results come in front of clinicians? And so that is really important. And the more, domain experts we have on board, the better. So I'll go through this really quickly because I know we're kind of getting to time. Am I doing our time? Yeah, I'm pretty close to time. So I just want to say, I'm also going to highlight pathology informatics teaching as a way to, to open doors in your own career. So I'm glad that there are ACGME milestones for informatics. It's more than some specialty has, but I think it's fair to say that it's not enough. This is it. There's the word data is mentioned in a couple other milestones, but the importance of informatics in practice of pathology is rapidly outpacing, I think the residency competency expectations. Overall, not specific to pathology, there are some barriers to scaling informatics education. And this, really boils down to a rapidly evolving body of knowledge, heterogeneity in the learner backgrounds. If you think about it, every medical student getting into medicine has to pass standardized tests to get there. But when they come to learn about informatics, data scientists, we have learners all over the board, right? From advanced to, I'd say, very entry level. Evaluation can be challenging. Knowledge does not always mean ability to practice. And then, like I said before, there's a lot of, there's not as much bandwidth as we need for, long-term mentoring. And it's really changing faster than we can keep up. I've joked with my trainees before, but if you go into the informatics office, you'll see like 2 books laying there. And that's, I'm probably like the only faculty who doesn't have a big stack of books. And that's because, that's just not how we use a lot of online books, but buying the physical books, they change pretty quickly because the information shifts so quickly as well. Everything is really a moving target. And so I just want to highlight that pathologists are in very high demand for informatics teaching. Just as an example of this, so pathologists, if we do clinical informatics fellowship, we often, we train predominantly in general clinical informatics and sometimes practice there as well. But of the 60 current national ACGME accredited CI fellowships, 10 are hosted out of pathology departments. All but one of those that I know of actually have a pathologist PD. And I can think of at least 4 others, like our own program here with me, that are hosted out of another department, but have a pathology PD. So close to a quarter of all informatics fellowships, in the US have pathology leadership. And we frequently are called on to teach our non-pathology colleagues general clinical informatics. It doesn't really work the other way around. And I put few here because I don't want to say I'm sure there's no non-pathologist informaticists who are teaching pathology informatics, but it's pretty rare. And I struggled to think of an example. And so, this means that if you train in informatics, you're going to be in demand as a teacher and have opportunities even outside of pathology. With that said, pathology informatics, we need teachers for pathologists. And this is because, pathology informatics has a lot of unique characteristics where it requires knowledge of the medical content, as well as the pathology workflows, and the informatics principles. But I want to say it's also very accessible because everyone in this room already has 2 out of 3 of those. And, gaining informatics principles really puts you ahead of 90% of other, pathologists in terms of your ability to teach. I will just say that if you offer to teach an informatics topic, even one that you are recently learning, you will be taken up on that offer somewhere. And so this becomes a really good way to open doors to new roles, especially I would say in professional societies, right? If you're able to join a CAP committee or even another working group related to informatics and can lead to jobs as well. Okay, I have some kind of practical examples. I know we're pretty close. We're at time, right? So I can do I have 5 minutes or? Oh, okay. I'm sorry. I thought I had to be done by 11. Okay, well, I'm doing okay. So I hope I've given some examples of, why it's worthwhile, continuing your informatics learning, even if you don't plan to do any additional formal training. And I have just a few slides here to talk about how some practical ways to do that. So this graph or table highlights the many pathways to getting pathology informatics learning, ranging from structured content in residency, which is still not much required, to fellowship, where acknowledging, that most trainees are not going to pursue a full year or two of fellowship. Other degrees, there are master's degrees, et cetera, in data science and informatics that some choose to pursue. A lot of the informaticists I know, including pathology informaticists, have gained most of their knowledge with on-the-job learning. And so this is really, I think, the recommended pathway, I would say, for starting. There's also an increasing number of continuing education modes, including major professional societies offering an increasing number of certifications, workshops, online courses. If you like technology anyway, or just like fixing problems, side gigs and hobbies can be a great way to strengthen that. And I was going to highlight, we had from Cleveland Clinic, their AI director, Dr. Samir Albara, has a great blog where he talks about his informatics passion, and also, his earlier in training side gigs like, garage door opening devices, right? That helped him learn. So it all reinforces the same kind of problem solving passion. And then informatics and information technology in general has a bewildering assortment of resources that are available for self-study, which I can say it can be a little overwhelming, but there is a really strong and tight pathology informatics community. And I think that's the best way to get engaged, to understand, what are the resources that are going to be the highest yield for me? Because it tends to be a pretty self-taught body of knowledge and skills. It's a really, really helpful to piggyback on the community. So if you are new to getting into informatics and you want to kind of figure out where to start, I recommend that you do some self-reflection, you identify your interests and skill gaps, what you think you know, where you think you need to shore up your knowledge. And, if you are making a goal, whether it's a goal to get through a certain, like the peer course or an online course, define what you want to get out of that at the end. Same goes for a project. And I think starting with your goals and then identifying a project or resource is helpful. I think that's actually more productive than just sort of, starting the other way around and trying to go to the resources first, because otherwise it can be kind of paralyzing. Like many of us, especially in practice, if you end up having very limited time, I think what I see in my teaching and in my practice is that the people who end up kind of stumbling into informatics, I was one of those. A lot of times it happens from what I would call like double dipping, right? You're working on something anyway as part of your QI or your practice of specialty passion, and you find a way to dovetail an informatics learning or project onto that. I think it's funny that I also have one of these archaic anatomy photo images from similar to the last speaker. But I also want to emphasize, not trying to swallow the ocean here, really starting small. And I really advocate for, I think the tried and true principle of it is better to have a project that you really understand deeply, beginning to end, especially initially, than trying to join, 5 or 6 projects at once and only being able to be superficially involved, especially at the beginning. You can get to that level where you can do multiple things at once, but it's very similar approach, I think, to having that, that medical student, cadaver that everything about that patient. It is definitely important to pick a manageable project that won't be too stressful for you, but it's also going to be more successful if you're not working alone. And if one thing that's really common to overlook is that if you're trying to solve a problem with an informatics solution, especially, where most of us now are using similar lab, LIS, and EHR applications, is that you're probably not the first person who's thought of that, right? And you can search online in the medical literature or some of our EHR vendor forums to see if somebody else has done that. Or actually looking through conference abstracts is a really good way to find out if someone else has done that. Really high success rate of reaching out to that person individually if you find their email or contacts, and you can make connections and build your success that way. We tell this to our fellows for every single project for informatics. If you can't measure it, it didn't happen. And so even if metrics end up sometimes being challenging to actually gather, depending on the project, it is always a good exercise to think about them up front. Think about what you want to get out of this. Am I doing this because I want to save 30 minutes, a day during practice? Am I doing this because I want to, reduce this number of errors by X percent? Actually putting that down, on paper, virtual annotation is really helpful to clarify your thinking and help you think of the process of how do I go backward then to even do this. That will often, defining the metrics will often help you think through what the solutions would be. And then, telling others what you're doing to provide some accountability can be a powerful way to make sure you're moving forward. Track down your local informatics team alongside those National Society community resources. So no matter where you're practicing, if you have an EHR, an LIS, or any electronic mode, there will be somebody who's responsible for informatics. Not every organization has a dedicated, allocated lab informaticist, but sometimes they may have clinical informaticists, other clinical informatics physicians who collaborate with lab. Lab directors end up in informatics work by default. And if there is no other informaticists, they end up responsible for, I would say, most of it. And then other leaders also within the lab often are key leaders of informatics knowledge. And then if you work in QI, you will be working with data, and QI leaders will always know where to find informatics. I recommend connecting with these great free resources. Like I said, there are many, many more. These are some that have been really, I think, well received by our trainees and I found very usable. So highlighting version 5 of Peer. We're going to hear a keynote from Dr. James Harrison later on a different topic, but he has a set of 9 freely available, freely accessible, really detailed slide sets that can be used for learning and or teaching, hosted on the Association for Pathology Informatics website. The CAPS clinical informatics resources is kept relatively up to date and has a rich trove of recent papers and guidelines, et cetera. And then if you're a audio or visual learner, Pathcast on YouTube has a whole section on digital pathology, and these can be played while you're driving or walking or just want to relax more than reading something. So in summary, I really and truly believe informatics should be done by pathologists, not to them. I think really the only way to ensure that is that every pathologist at some level is involved in and knowledgeable about informatics work. And so, maintaining and growing your knowledge and skills can give you the tools that you need to improve your current practice, help with navigating the coming changes with technology expansion, and then open up doors to different options within your current career, or even different career options than you may have thought possible. So with that, I wanted to say thanks especially to my education mentors and education champions for pathology informatics during my 4 years so far at UMN, and I think several in the room today, Drs. Cranwood, Chrisan, and Mike Leger, our informatics champion, Dr. Firkt, Colleen, Dr. Pankratz, my research mentor, and Dr. Khalifa, and then also has been integral in my teaching, the influence of Dr. Harrison, who we'll hear from later today. So with that, that was a lot of information. Wanted to say thank you for listening.
Thank you very much. Wonderful talk. There are a couple of questions. We are a little bit over time, so we have to make that short. I really liked what you said about Netherlands group, about implementing artificial intelligence, and we have to think about starting that with the next academic year for our trainees. I mean, if there is one thing to remember, yes, I agree with what Mara was saying, earlier, that artificial intelligence will not replace pathologists, but you can be absolutely sure that pathologists without artificial intelligence training will definitely be replaced with pathologists who are having those skills. So, John?
Michelle, thanks for that discussion. You mentioned earlier that the EHR has been a little bit involved in the burnout of pathologists. I would venture that the EHR has been involved in the burnout of clinicians in even a higher percentage. And the question I have is there any progress in changing the orientation of the EHR? The EHRs have been developed for the benefit of the billing offices. Is there any progress in getting EHRs that are actually for the benefit of the patients and for the benefits of the healthcare providers? And is AI going to play a role in this?
Yeah, so briefly, I think the short answer is I do not think that there's going to be a massive kind of infrastructure change, right? The more, especially now, we've gotten really, I think, a critical mass of, in Minnesota especially, investment in a single EHR, which is Epic. Most of us are on Epic. There's just, the sunk cost and effort into changing the core structure of the EHR is difficult, but we are seeing real gains. And on the clinical side, those gains are being powered by AI. A specific example that is happening right now is the advent of AI ambient scribe. And this is, where for many years now, if you go to the doctor is likely to be typing into a computer and looking at the computer instead of listening to you. With the implementation of these tools, the AI scribe listens to you, the clinician listens to the patient, transcribes the interaction, pre-populates with predictions, kind of what the note needs to say, and then you, as a clinician, still the human in the loop, will make decisions and edit. For the clinicians that have adopted this, many have said it is life-changing, right? They feel like they have their practice back. That's where I think those gains that we're seeing in burden reduction for clinicians need to be translated to pathologists in a meaningful way for those tasks where we're spending a lot of, time that I would say is not value added. And some of it could be in report generation for sure. Yeah.
Yeah, thanks, Michelle. Quick question. So recently I discovered that Pathology Informatics Fellowship, it looks like it's what you define it to be from institution to institution. So is there any standard curriculum? It's just so amazing that when you talk to fellows coming out of informatics program, what they covered and what they learned are not always the same thing. And it's very difficult to find, something. So what's the guideline? How is it regulated? And is there a curriculum that's expected?
Yeah, I'll talk about the ACGME clinical informatics fellowships. There are only, I think, like 4 or 5 left of the non-accredited pathology-specific ones, which were highly tailored. So most trainees now are going into these ACGME CI fellowships. There are standardized ACGME milestones, and they cover a wide variety of informatics topics, including pathology informatics, which is a small portion. So I'd say that there is a baseline coverage of a wide variety of topics. Within that, though, those pathology trainees who go into those pathways, I would say, still have a lot of ability to really tailor their experience to what they want to get out of it. Because I think, 3 main areas, I think, for pathology informatics training are we have, people who are really interested in genomics, which involves a lot of bioinformatics, digital pathology and image analysis, where I think you need domain expertise, signing out, I think, to be the most successful at that. And then, the kind of the clinical informatics EHR integration subspecialty. So it's my hope that in the future, we'll actually see subspecialized pathology informatics fellowships like in digital pathology, genomics, et cetera. But right now, the fellowships are still pretty flexible to allow trainees to get expertise where they need to. Yeah. Thanks.
Thank you very much, Michelle.